In cosmetic dentistry, if you can learn to train your eye to see these things, your veneer cases will become better and you will see and create better results. You will have happier patients and you will do more and more veneer cases. So let's review some of the principles of smile design in detail. When we understand smile design, we begin to enhance our abilities to see the possibilities in someone's smile. And we begin to understand the ways in which we can improve a smile. When I look at someone for the first time and I'm evaluating their smile for a smile makeover or any type of cosmetic dentistry, I'm looking at the face, the eyes, the lips, the nose, the jawline, the chin, the smile, the teeth, the gums, and how they are all related. Ultimately, I want to see how the smile fits with the face. I want to see how the teeth fit in with the smile, and I want to see how the gums fit around the teeth. I start evaluating the smile and what we can do by first taking a big picture view, then I get more of a macro or close-up view by the end. These are the following guidelines that you can use to evaluate someone's smile and also ideas on how to improve a smile. So let's review the case that I shared at the beginning of the course in more detail. In this case, we're going to look at the following smile design characteristics. Number 1, the size of the centrals and tooth display. Number 2, the gum levels. Number 3, the shape of the teeth and the embrasures. Number 4, the symmetry. Number 5, the color and incisal characteristics. Number 6, the fullness or buccal corridor. Number 7, the alignment. Number 8, the midline. Number 9, the cant or level. Number 10, the occlusion. Number 11, the smile line and lip line. And number 12, the axial inclination. Number 13, the negative space profile. And number 14, the lip dynamics. So let's break it down. Number 1, the size of the centrals and tooth display. We want the teeth to be longer than they are wide. Teeth should have a rectangular outline versus a square outline or a triangular outline. Another guideline for women is when the lip is at rest to show at least 2 millimeters of tooth display. The average height or length of centrals can be anywhere from 9.5 millimeters to 11 millimeters. Number 2, the gum levels. We want the gum line of 8 and 9 to be at the same level, then the laterals to come down a bit, and the gum line of the canines to be around the same level of the centrals. Then the gum line of the premolars to be slightly lower than that. Number 3, the shape of the teeth and embrasures. The more open embrasures there are, the more natural a smile can look. The embrasure between the centrals is the most closed, with the adjacent embrasures becoming more open or deeper as we get more distal and posterior in the smile. The embrasures create the shapes of the teeth. The more closed the embrasures are, the more flat and square the teeth appear. And the more open the embrasures are, the softer and more feminine the teeth appear. Number 4, the symmetry. We want the centrals to be symmetrical or mirror images of each other, the laterals symmetrical to each other, and the canines with each other, and the premolars with each other as well when we compare one side to the other. Number 5, the color and incisal characteristics. A gold shade or color for a new smile can be similar to the color of the whites of the person's eyes. The more incisal translucency the teeth have, the more natural they can look. The most requested shade for veneers at our office that we use is a BL2 for a natural white color. We often use a BL2 shade with a high translucency ingot for HTBL2. If someone wants a more natural look, we would suggest a BL3 shade from the Ivoclar Bleach Shade Guide. Number 6, the fullness and buccal corridor. When someone smiles, we want to see the premolars. If a smile is narrow and the premolars are hidden, we often will recommend doing up to 10 veneers in a veneer case in order to give that person a broader smile and to build out the buccal corridor. Number 7, the alignment. The alignment or arch form is one of the most important concepts of smile design. When we view the arch from an occlusal view, we can see where the teeth are in line versus deficient or sticking out. Evaluating the alignment helps us determine the amount we have to prep in order to get the desired result and help us determine if we need to consider ortho before veneers. Number 8, the midline. We want the upper teeth dental midline to coincide with the nose, chin, and between the eyes. A straight midline, even if it's off-centered, is better than a slanted midline. Number 9, the cant or level. We want the level of the teeth to be parallel with the interpupillary line, or the horizon. Number 10, occlusion. We want to make sure there is an ideal occlusal relationship, or we may have to consider treating more teeth or ortho before veneers to improve the bite relationship. Number 11, smile line and lip line. We want the edges of the teeth to follow the lower lip wet border and fit into the frame of the lips. Number 12, axial inclination. We want the teeth to be upright or have a slight mesial inclination. We don't want the teeth to be angled and pointing in different directions. Number 13, negative space profile. From a side profile view, it's ideal when the teeth are parallel to the spine and not angled forward or angled too much in. Number 14, lip dynamics. When speaking and smiling, we want the teeth to fit perfectly within the facial features and within the frame of the lips.